Okay, so I will present the screen. Okay, my screen is visible to you all.
Yes.
Yes, ma'am.
Okay. So today, as you all know, that we are going to start our Unit 8, Therapeutic Yoga. First disease will go for respiratory disorders. First of all, we'll see a little into the syllabus. So this is our syllabus, exactly same what we have. So this is therapeutic yoga. So here, like yogic practices, I will give you a make a big 1 second. Yes. So yoga practices. So we'll go for management of the disease through suitable yogic practices. It could include diet, yama, niyama, anything like all the aspects, all the koshas. Here, a special thing which is mentioned, I marked it as a highlight also. Here it is integrated approach of yoga therapy for the all the ailments we'll see. So what is exactly the integrated approach of yoga therapy? We'll understand that. So when we work on each and every koshas, hopefully you all know about the koshas. Yes or no?
Yes, ma'am.
Yes.
Yes, ma'am.
When we work on all the koshas, all the 5 koshas, Annamay Kosh, Pranmay, Manomay Kosh, Vigyanmay Kosh, and Anandmay Kosh. When we all together work on all the koshas to heal any particular problem or disease, then that aspect is called as integrated approach of yoga therapy. So, like this, we'll go ahead. We'll go for all the diseases. There are respiratory disorders, cardiovascular disorders, endocrinal disorders. All you know the syllabus. Then gynecological disorders, gastrointestinal disorders, musculoskeletal, and all the systems it is having. All the diseases related to all 9 systems. So we'll treat all them using all the 5 koshas. So through what procedure will go. Now, this is not in our part of the syllabus. All the diseases are okay. But to understand a little glimpses there, we'll first start with respiratory system because respiratory disorders, first is disorder is with the respiratory. So how we'll go? First of all, we'll understand the disease a little about the system, then the disease, exactly what it is. Not too much like deep we need to understand, but exactly what exactly the disease is and what are its management. So in respiratory disorders, if 3 diseases are given, we'll study one by one disease, and then further we'll go for all together management of respiratory disorders and one class at last, that yogic management of all the respiratory disorders. Like that, in this procedure we'll go with the flow. Okay, understand? To confirm,
Yes,
please,
ma'am.
some.
Yes, yes, yes.
Yes. Okay, very good.
Yes, ma'am.
So now we'll start. So what exactly the respiratory disorders? Hopefully you all know that this related to our lungs. Like a short note, we understand that it is related to our lungs or upper respiratory tract. So all of you know this, but a little for glimpse, I have put this here. The organs that are involved in the breathing includes nose, throat, larynx, trachea, bronchi, lungs. We all know that this is only called respiratory tract. Okay, the pipe that is trachea and touching to the lungs and coming from the nostril inside. This whole includes respiratory tract. So this respiratory tract is further divided into upper respiratory tract and lower. So what is upper respiratory tract? Our mouth, then nostril through which we inhale, nasal passage. Further from nose, the breath will go into nasal passage. Then pharynx, upper section of the throat is pharynx, and sinuses, nasopharynx, because behind the nasal passage and in front of like pharynx, this is sinuses. All the sinus I will tell you that how what sinuses are, everything. Then larynx. So make sure that sometimes in some places it is written that in some books that this larynx is involved in upper respiratory tract. In some places it is said that it is in the lower respiratory tract. There is no problem, like sometimes it is last part na, like merging or middle part, so they put sometimes in upper part and then lower part, not like that. But usually we used to say in upper respiratory tract we have this, you can see here, nasal cavity, pharynx, larynx. Okay, and then further in lower respiratory tract, this is here, we have trachea, bronchi, bronchus, bronchioles. All these are nothing but the branches. This bronchi, bronchus, bronchioles. All these are branches, further branches of the trachea only. Okay. Then further at the last we have bulge, like here it is not marked, bulge like structure or a circular structure which is called as alveoli or alveolar sacs also we used to call it. And then further lungs, whole lungs. This involves a lower respiratory tract. So whatever in the upper region is upper respiratory tract, whatever from the trachea lower region, it is a lower respiratory tract. Okay, further we'll go ahead. Is it clear to all?
Yes, ma'am.
Yes,
Okay,
ma'am.
you all
Yes,
know,
ma'am.
है ना? Further with disease. So respiratory diseases, what exactly happen in respiratory disorders? These are the conditions or group of the pathogenic conditions, okay, which affect our respiratory system. Therefore, it is respiratory disorders. So exactly from here our syllabus starts a little glimpse to understand the further. So allergic rhinitis is the first disorder we have to study in respiratory disorders. So what is exactly allergic rhinitis is? Allergic rhinitis, the inflammation of our nasal passage, nasal membrane is characterized by the symptoms. When there is inflammation in our nasal membrane, which can cause further some symptoms. This is called, this condition is called as allergic rhinitis. But exactly what happens in allergic rhinitis, we'll see ahead. So it impairs, of course, any disease or any discomfort. It impairs the quality of life. Further, allergic rhinitis is also called as hay fever, is an allergic reaction to the tiny particles in the air. So whatever the tiny particles which are present in our environment, which unknowingly we enters into our body, how? When we breathe in. So whenever we breathe in, these tiny particles which are even not visible to us normally are entering to our nostrils or into our body. These are giving bad effect to our body. Then these particles are called as allergens. Okay, this is very much understandable, I think so. When you breathe in, therefore it is written, will not go through line by line, but still after reading this, I will make you understand what exactly it is saying. So when you breathe in the allergens through your nose or mouth, your body reacts by releasing a natural chemical called histamine. Okay, whenever we breathe in these allergens, what are the allergens? The small tiny particles. When we breathe in, our body releases a natural chemical called histamine. So what is exactly the work of histamine? We'll see in the next slide. Several indoor and the outdoor allergens can cause the hay fever or allergic rhinitis. Outdoor and indoor allergens could be there. So what is histamine? So what happens in our body? Histamine is nothing, it is a type of chemical only. So when our immune system, if someone have the low, this slide is okay for everyone? Please reply. Hari
Yes,
Om.
ma'am.
Yes, ma'am.
Yes, ma'am.
If any network issue is there, na, please kindly, or sometimes it
I'm
happens
a
that
little bit slow, a little bit slow than
okay,
this.
okay, yes, that I am saying that please stop me there. And okay, so histamine, what will not read, but I will make you understand what exactly there. So what happen in our body when the someone have a little weak immune system? So what happens, his immune system is that not that much mature. We can like to understand, you go through like this, our immune system is not that much mature. So sometimes these allergens or some tiny particles which are in our environment, they are entering in our breath, through our breath inside our body. So our immune system think that this is not exactly, though these particles are not harmful for us, these outside particles, allergens, are not harmful for our body. Still, as our immune system is not that much strong, so our immune system wrongly understand this allergens or this tiny particle to be that this is very harmful for me. Okay, he understands. So what exactly I say, I will repeat this. When our immune system is not that much strong or immature, I can say, so at that time, whenever these tiny particles, allergens, enters in our body, which are exactly not harmful for our body, but our immune system wrongly understand them that these are harmful for us. Okay, they wrongly understand this. So in turn of that they, our immune system think that these are harmful for us, for these harmful particles, in turn of it's or return of this, our body start releasing the chemical, because some everything have some reaction. So as he's understanding that it's harmful for us, to fight against that is our body start releasing the chemicals. There are many chemicals, but main chemical for this is a histamine. Histamine is main chemical which is playing role in this. Histamine, what happens then when histamine will release, this histamine will start showing us symptoms like what this symptoms of allergies, runny nose or congestion in the nostrils, headache, sinuses or eyes paining, redness of the eyes. When regular the condition is happening, this can be diagnosed as the allergic rhinitis. So this is exactly the work. This is the main cause only. This is written in further slides. Also, it is written properly. Whatever I make you understand, this is written in the words. So, like in this diagram, also I'm showing you like histamine is there. When allergens enters inside the body, histamine is not able to understanding because it is not that much strong. Is not able to understand whether it is the enemy or it is the friend. The allergens is coming is friend. Friend means it is harmless or harmful. So though it is not harmful, still he understand, though it is not harmful, still he understands, our immune system understand this is harmful for my body, and in turn of this start releasing the chemical, and many chemicals are there. Main important is histamine. So whenever the histamine release, it shows some symptoms like runny nose, sneezing, headache, eyes pain, nostril pain, and mucus in throat, everything symptoms like that, which we have in allergic rhinitis. The condition when continues for long period of time, it can be diagnosed as allergic rhinitis. Hopefully this slide is clear to everyone. If some problem, you
Yes,
can ask.
yes, ma'am.
Yes,
Clear.
clear?
Yes.
Okay. Okay. So exact, because the main thing in this is histamine only. So this is need to be understood very properly. Okay. Further, it is symptoms of allergic rhinitis. There are many symptoms, but some we can put here. Na? So symptoms of hay fever. This is nothing but hay fever could happen throughout the whole year. I will make you understand in next further slides that classifications throughout the year or sometime in episodes. Some episodes will understand that. First of all, we see symptoms of the hay fever. It includes rhinorrhea. Rhinorrhea is nothing but runny nose itself is rhinorrhea. Okay, most often in this, clear to the white in color. Our mucus will be clear to white in color. Now sneezing, 5 to 10 sneeze or more regularly and daily and regularly at the continuous time interval, then it could show the symptoms of this. Then nasal stiffness or congestion in your nostrils, sneezing, runny nose, etc. Then your itchiness in the nose. Sometimes we feel itchiness or in the nostril, like very discomfort condition. It is when we exactly feel the that problem. No? Throat, this itching in throat, eyes and nose. Then your headache, also sinuses pain. Sinuses pain is in sinusitis we'll see that you know that below the eyes there are sinuses, two sideways on the cheeks region, and then on the front of the forehead, in middle of the eyes where we put bindi, and behind that also we'll study the all the sinuses in the sinusitis. Then increase mucus in the nose and the throat. Of course, such a problem is there, the mucus in the nose and throat. Then fatigue in the malaise. But generally, the person will feel when in normal condition, he is normally having. So he will now definitely going to feel discomfort when all these problems are happening, regular sneezing, regular paining, everything. So now sore throat from the mucus dripping down to the throat. That means post nasal drip. What exactly the post nasal drip? The mucus drainage is happening not through nostril. In runny nose, it's nostril. It drips into or drainage happening into the throat region. Okay. Then whizzing sounds or coughing, trouble in breathing. Of course, when there is a mucus block, mucus, lots of mucus is there, it is blocking your nostrils. It will create difficulty in breathing. Hopefully, these symptoms are clear to all. Okay.
Yes, ma'am.
Yes, ma'am.
Very good. Okay, now causes. I make you understand the causes before only in histamine slide, but still I will read and make you understand what here. Same what make you I tell you. This is written in the words. Okay, allergic rhinitis occurs when your body immune system reacts to the irritant in the air. These irritants are that only allergens only, tiny particles or allergens. Okay, here it is written irritants, allergens, and the irritants or allergens are so tiny that you can easily inhale them through the nose or the mouth. Okay, that I told you, these are very small, we can easily inhale. The revision type of it here will happen. So very small, we inhale them. In when we inhale, these are irritating particles, so our body will not bear it. Okay, allergens are harmless to most of the people. Okay, these are not harmful for all, these are harmless to most of the people. But if you have hay fever, or hay fever means allergic rhinitis, if you have, your immune system thinks, matlab I said you na, our immune system will wrongly understand it. Okay, our immune system thinks that allergens is intruding, means it is harmful for me. This is understanding. The immune system tries to protect your body by releasing natural chemicals. Of course, if our immune system is thinking that this thing is harmful for me, in turn of this, to make him to make him safe, he will release some natural, to protect him, he will release some natural chemicals which in your bloodstreams. Okay, many chemicals are there. So the main chemical is histamine. Exactly, the main chemical is histamine. It causes mucous membrane in the nose. These are symptoms of then when histamine will release. What are the further symptoms of histamine? So it can cause the mucous membrane in the nose, eyes, and throat, and become inflamed and itchy. All the symptoms what we have seen before, as they work to eject the allergens, because they are working against the allergens. So all these symptoms are visible. Okay. Okay to everyone. Causes.
Yes, ma'am. Okay, ma'am. Yes, ma'am.
Very good. Now we'll understand the disease is complete. Now we'll understand the classification, how this allergic rhinitis is classified. 1 second, just I'm doing it. Okay. So depend on the different like in context of different things, it is will happen. Depend on whether the symptoms are seasonal, perennial, or episodic. We'll understand the classification. Someone, please mute your mic. Your mic is open. So classification is on the basis of whether the symptoms are seasonal. It will be seasonal or throughout the whole year, or sometimes it will happen. We'll see how. So seasonal allergic rhinitis, when it happens, seasonal allergic rhinitis in seasons, like some people will be allergic to some particles when there is winter, some people in rainy season, some people in summer season. Okay, likewise in different seasons, people are allergic to different allergens. It could it is individual. Okay, it could happen, it depends on person to person. Okay, so when these allergens or these particles, tiny particles, or irritants are affecting you on different seasons, this such allergens or such kind of condition or such kind of allergic rhinitis is called as seasonal allergic rhinitis. There are many examples, but just to make you understand, there are some pollens, outdoor molds, etc. These are the examples. So because you understand the pollens, when in different seasons we can make this. Sometimes when season change, then also the people get these conditions. So there could be some allergens or some tiny particles or these irritant particles which are affecting their body. It depends on body to body. So exactly what we understand in this, that is seasonal allergic rhinitis when we come in contact with allergens depending on the season, different seasons. Its condition is called as seasonal allergic rhinitis. Then we'll go for perennial allergic rhinitis. What is perennial allergic rhinitis? It is caused due to the allergens. Yes, caused due to the allergens which are present throughout the whole year. This allergic rhinitis is a perennial allergic rhinitis is throughout the whole year, throughout the whole year. It like it would happen throughout the whole year. There is no episodes, no condition, no seasons, etc. So throughout the year it could happen. Therefore, for some examples are there: grass pollens, some trees which will be there in throughout the whole year. House dust. House dust could also be like episodic. Sometimes it could happen like today it is happening, or episode we'll see next in next slide, the episodic one. House dust also comes under that. Cockroaches. Yeah, throughout the whole year it could be there. So this also comes. Some people are allergic of cockroaches also because they release some tiny particles or like that. So this is clear seasonal and perennial allergic rhinitis.
Yes, ma'am.
Yes.
Okay. So next, sporadic allergic rhinitis. What is sporadic allergic rhinitis? It is intermittent brief episodes of the allergies. Okay. So this is not exactly the daily it will happen or seasonal it will happen. Anytime the intermittent in between, intermittent means in between episodes could happen for the allergies. This is sporadic allergic rhinitis. Okay. So I told you that it could be happen in house dust is in there also and here also. So it could be intermittent or in episodes also it could happen due to pet animals dust. Matlab, sometimes animal hairs like dogs hairs, etc., or their the particles or something they are their body releasing, it could also make allergic to people. Okay. Or some foods, some food items we used to say na, like this food is not this food is allergic to me in this time. Sometimes it is allergic to me, sometimes it is okay for me, I used to eat it. And sometimes so in some episodes also, in intermittent episodes and between it could affect us. Sporadic allergic rhinitis. Now we'll move for occupational allergic rhinitis. What is occupational allergic rhinitis? It is exposure to the allergens at workplace. Wherever we work or workplace, when we are coming in contact with these allergens at our workplace, this is called as occupational. By name itself it is clear, in occupational allergic rhinitis. It could be outdoor workers or like in agriculture workers, exposure to the pollens, animals, grains, etc. Some people have a problem or allergies with grains also, like the particles or anything releasing from grains. Okay. Wood dust. If someone working at wooden places or some wooden factories or anything, there could it happens. So this is occupational allergic rhinitis. So with this, this disease is completed. Allergic rhinitis. Any problem or doubt in this slide? Last slide.
No, ma'am.
Easy. So this is complete. Shall we go for next disease also? Next is
Yes,
our
ma'am.
Yes, ma'am.
sinusitis. So sinusitis, we'll go for that. 1 second. Okay. Hmm. Okay, sinusitis. My screen is full. Full screen is visible.
Yes, ma'am.
Yes,
Okay.
ma'am.
So allergic rhinitis clear to all.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
So sinusitis. As you were seeing, 1 second, highlight. Hmm. As we are saying that itis, whenever there is word itis, it means it is swelling or inflammation. Okay. So sinus. first it is first word is sinus and then itis. So inflammation, it is by name itself we can understand when there is inflammation in your sinuses, the condition is called as sinusitis. Further we'll see what happens, but with the name we are understanding what exactly the name indicating to us. Okay, now first of all, as I we there we studied the respiratory system, we see the glimpse of respiratory system. Here we'll understand what are the this there is the condition is showing that inflammation in sinuses. So what are exactly the sinuses, what are the information of sinuses, we'll see. Okay, so what are paranasal sinuses? Paranasal sinuses, all together the sinuses in our middle or head or in our facial regions, these are all together called as paranasal sinuses. So what are paranasal sinuses? One second, I'll drop this. So paranasal sinuses, paranasal sinuses are a group of the four paired air-filled spaces that surrounds the nasal cavity. So four paired, okay, four pairs are there. That means 8 in number individually and 4 in pairs. Okay, how it is 4 in pairs, I will show you. And this is air-filled spaces. What exactly the sinuses are? They are nothing but the empty spaces. So empty spaces, therefore, we'll say air-filled spaces. As they are empty, therefore, air-filled spaces these are. Okay, so how these are 4 in pairs? So this these are eyes. Below the eyes, there are two sinuses. This is below the right eye and the left eye. These are maxillary sinuses. These are called maxillary sinuses. In words, it is written here, maxillary sinuses located under the eyes. When there frontal sinuses which are above the eyes. And why it is named as frontal? Because in the front of this is frontal bone, then in frontal lobe of our brain. So in the region of frontal lobe, therefore it is called as frontal sinuses in front of our forehead. These two are frontal sinuses. Two means a pair of. Okay, then we move. There is ethmoidal sinuses. Hopefully you all have studied this anatomy and physiology.
Yes, ma'am.
Yes, ma'am.
In that you may understand this study this ethmoidal bone, sphenoidal bone. Yes.
Yes, ma'am.
In this that bone system that. Okay. So here, ethmoidal sinuses are there. In ethmoidal bone region only, when the sinuses are present, it is called as ethmoidal sinuses. So these are also pair. These are exactly the position is in between the eyes. Okay, in front part, ethmoidal. Like I will show you. If we are having the dissection like this sphenoid bone is a butterfly type bone. It is also called as butterfly bone. You should know if you haven't studied. And front, this is our front part. Okay, this is our forehead. We are seeing this is our forehead. So this front is ethmoidal bone is there. So the sinuses which are all air spaces which are present in this region, ethmoidal region, are called as ethmoidal sinuses, and which are present in this butterfly shape. This is butterfly shape. Sphenoidal bone is there. The sinuses present in this region are called as sphenoidal sinuses. Okay? Behind the eyes, it is written. Hai na? Therefore, I show you like dissection like this. That this is our forehead. These are our eyes. Okay, this is eyes. Very bad drawing. Sorry, but you have to manage. Okay, these are eyes. Behind in front region, this is ethmoidal bone. So here it is ethmoidal sinuses. Behind that butterfly shape, this sphenoidal bone is there. The sinuses which are present here are called sphenoidal sinuses. Okay, therefore it is written behind the eyes. Behind the eyes means in back side. Okay, back side. So understand everyone? Any
Ma'am.
doubt with this? Positions, anything? No? Okay.
No, no.
So now exactly we'll go for disease. This is to understand the sinuses, and then you can so that why I'm making you understand all this, so that you can visualize this. When we are studying the disease, you can visualize, okay, this is here and the problem is happening here, so that you can easily understand that. Okay, now definition of the sinusitis. Sinusitis is the inflammation of the mucosal membrane in the lining of sinuses. If see, I'll show you. If these are your sinus, okay, this is one side sinuses. The inflammation of these, this is inflammation. Okay, we are saying this region is inflamed region. Okay, inflammation of the mucosal membrane of your sinuses. In allergic rhinitis, there is inflammation in the One difference is there, that it is happening due to the allergens or external particles entering into our body, and there is inflammation in nostril region, nasal region, nasal passage. Okay, here the inflammation of the outer membrane is, of course, in every region. If you understand in anatomy physiology, outer region is mucosal membrane to protect us, soft membrane. Okay, when there is inflammation in this mucosal membrane, it is called as this uh, mucosal membrane of sinuses. This is called as, condition is called as sinusitis. Okay, inflammation of sinuses, and there it is inflammation in nasal passage. Okay, mucosal membrane lining called as in the sinuses. So sinusitis is the inflammation of the mucous membrane lining the sinuses. Whatever the inflammation of the last mucous membrane is called sinusitis. Healthy sinuses are filled with air. Of course, I told you before only that there is empty spaces. These are, so definitely we'll say that it is filled with air. So therefore, it is written healthy sinuses are filled with air, but when they become blocked and filled with fluid or mucus, okay, germs can grow and cause infections. It is written. Okay, when these sinuses, if it is sinuses, this is blocked. Okay, when blockage will happen, if it is blocked with the fluid, the germs, of course, when it is blocked, the germs can grow there. In every place we know, the germs can grow there and can cause the infections. It will cause the infections and can lead to the problem. Okay, so exactly the difference, because this is the main slide for understanding this exact disease. You understand this or not? Definition. And what is the
Yes,
difference
ma'am.
between
Yes, ma'am.
allergic rhinitis? Because it's a little similar. Allergic rhinitis
Ma'am,
and
please repeat the difference between sinusitis and the other one.
allergic rhinitis. So I'll make you understand. First of all, I'll rub this. 1 second. Huh. See this. So in allergic rhinitis, what happens? Due to the effect of outer thing, okay, outer thing that we are seeing to allergens, okay, or that's tiny particles which are entering into our body from outside. It happens that is immune disorders. Okay, immune disorder, because our immune system is weak in not understanding it to be the, like, it is harmful for us or that. So when some outside material is entering inside our body, or outside allergens are entering inside our immune system is wrongly understanding it and making the reactions to it, like congestion in nostrils, headache, everything also happen in sinusitis. But the main difference is, in sinusitis, by name itself we understand, in sinuses, the itis means inflammation in sinuses is called as sinusitis. So I'll show you here, as this is this is visible, red color, this is visible.
Yes, ma'am.
Yes. So these are your sinuses. These are your sinuses. The outer part of the sinuses gets inflamed. Okay. This is inflammation. The outer region. It's inflammation. So inflammation, or in easy word you can understand, swelling. Swelling in the outer membrane. Outer membrane is always, if you understand in this anatomy, outer membrane is always mucous membrane. Okay. Mucous membrane. Mucosal membrane we also used to say. Mucous membrane. So when this mucous membrane or outer membrane get inflamed, outer membrane of what? Outer membrane of sinuses is getting inflamed, then it is called as sinusitis. When the outside material is entering inside our body and we are getting allergic to it, and our nasal passage, nasal mucosal membrane is swelling, that condition is called as allergic rhinitis. Sinusitis is inflammation in sinuses. Allergic rhinitis, inflammation in nasal mucosal membrane. Okay, now understand, the one who asked.
Yes, ma'am. Yes.
Now everyone clear? If someone have doubt, can ask. Okay,
It's
we
clear,
can go.
ma'am.
Okay. So now the main disease is okay, and now causes will understand. What are the causes? Upper respiratory tract infection can lead to this sinusitis. Of course, these are very common. Huh? Allergic rhinitis. If we have allergic rhinitis, congestion in the nostril, or blockage, or like blockage in your nasal mucosal membrane, it can also lead to that there could be the blockage in your sinuses. Your blockage in, I will repeat, blockage in nose can lead to blockage in sinuses. Okay, so therefore allergic rhinitis could also be the cause for sinusitis. Then nasal polyps, if happens. Okay, nasal polyps could also be the reason for allergic rhinitis. One second. Then deviated septum. We used to say na sometime that if you are from the yoga field, if some people enable to do that Sutaneti and all, we used to say that I have deviated nostrils. This just like nasal polyps, everyone understand. These are nothing but like painless, no a little extra growth we can say. Okay, in easy word, extra growth. Okay,
So
extra
bone,
growth.
ma'am,
What
the size of the bone of the nasal passage increase.
in nasal polyps?
Yes, ma'am.
Matlab
I'm
I am
asking,
saying
is it right or
no, size of bone doesn't changes. Actually, the a growth of extra growth of the tissues, ठीक है, accumulated. So we used to say ना कि ये बढ़ गए, like it increased, the size is increased. We wrongly understand like that. But exactly what happened, there is extra growth on of the tissues on the lining of the nose. Okay, or the lining of the sinuses. ठीक है, these growth are painless but extra growth, so extra it is visible. These are nasal polyps. Okay, you can write in your notes. If you make notes here in the class itself, we'll revise at last of the class, or after, like next day we can revise. You will be able to understand here only because very less time is there no, now. Okay, and then next is deviated septum. Okay, which it shifts in the nasal cavity. Deviated septum, which is a shift in the nasal cavity. So this is also a what sideways. It is a little displacement of the wall between the nostrils. When where the exactly wall should be there, na, it a little displacement or a little change in the position of it, a little like it could happen sideways or left or right. This is called as deviated septum. ठीक है, in Hindi we used to say that मेरी हड्डी बढ़ गई है, like that. हड्डी नहीं बढ़ गई, it is exactly this. Nasal polyps. So what is difference in between nasal polyps and deviated septum? Nasal polyps are extra growth. Okay, extra growth, or these some tissues. These are painless, though it is painless, but extra growth of the tissues is there or cells is there, which get accumulated. We feel that it is. So again, how it is can cause the sinusitis. So this extra growth will definitely going to make the blockages there. So will lead to sinusitis, inflammation in the sinuses. Then deviated septums are little. If your nostril wall is like this, it is getting deviated, a little deviated from the main position. So it can also lead to this. These are like in picture. These are bacterial infections, fungal infections, allergic reactions, viral infections. Some medications also can lead to. Sometimes you know when we used to take this medicines for cough, cold, etc. We feel some. Matlab, we eat. Though runny nose is not happening, rhinorrhea like runny nose is not happening after that, but something blocked. We feel after eating medications also. So it is also could happen. Then nasal polyps we studied. Dehydration also could lead to their causes, and then symptoms. Symptoms are facial pressure, pain. Will go fast. Huh? We'll complete this. Huh? Hyposmia and anosmia. I'll tell you. Then nasal congestion. I actually seen nasal congestion is there also here also. So because it is related disorder, na problem in ENT upper region and respiratory tract region only. Okay, nasal discharges happen, fever, cough, fatigue, maxillary dental pain also happen because it will affect the whole region, ear pressure, etc. One second. We'll complete it now. Lots of lights are there. Okay, classification now we'll go for symptoms, and that are easy. You can even step by study you can understand. Main now understand classification based on the location. Location ki kahan par hota hai, okay? So that where it happens. Maxillary sinusitis as from the diagram itself, okay? You understand maxillary sinusitis. Where are maxillary sinuses are there? Can anyone tell? Unmuting.
Under the eyes.
Huh?
Under the eyes,
Ma'am,
ma'am.
under the eyes, ma'am.
Okay, very good. And ethmoidal sinuses? Ethmoidal
Just
sinuses?
adjacent to the eyes in inner side.
Yes. Yes. And now someone else. You don't unmute. Sphenoidal sinuses?
Behind the eyes.
Okay. And frontal sinuses in front of them. Okay.
Front
So
of.
this is very easy on based of the location. If sinusitis means inflammation. Inflammation in the sinuses is happening due in happening, and it is involving this maxillary sinuses that is below the eyes. Okay. Bad diagram will make. Recording is on now.
Yes, ma'am.
Yes, ma'am.
Okay. This sorry for diagram, because here I didn't pick the picture. So when the involvement of these below the eyes maxillary sinuses, then when involvement of maxillary sinuses will happen in or inflammation of these happens, then it is called as maxillary sinusitis. When the involvement of ethmoidal sinuses in between the eyes will happen, the involvement of ethmoidal sinus will happen, then it is called as that means involvement means here involvement meaning that inflammation of ethmoidal sinus is happening, that is called as ethmoidal sinusitis. If involvement of frontal sinus is happening, that means that swelling or inflammation of frontal sinuses is happening, and it is called as frontal sinusitis. If the involvement of sphenoid sinuses is there, that means sphenoidal sinusitis. Sphenoidal sinusitis means behind the eyes. Okay, that I show you in a butterfly shape bone is there. So that is called sphenoidal sinuses. So depending upon that which pair of sinuses are swelling or which pair of sinuses are inflammating, we can classify them. Okay, this is, you understand, hopefully very easy.
Yes, yes, ma'am.
Very good. Now, based on the number of the sinuses involved in the inflammation, okay, multiple sinusitis. This is multiple sinuses. More than one sinuses is involved. When more than one pair of sinuses are involved, is called as multiple sinuses. Like if we'll see, eyes are there. If ethmoidal and frontal both sinuses are involved, then it is called as this multiple sinusitis. Then pan sinusitis, all the sinuses are involved, all sinuses together are involved. This is very severe condition, the person will get mad or something else. Okay, when all the sinuses, in starting we see na, that four pairs of sinuses. Four pairs means individually 8 sinuses, individually 8 sinus, but 4 pair of sinuses are all together involved, then the condition is called as pan sinusitis. Multiple sinuses when more than one sinuses is involved. Okay, based on duration of the attack, acute sinusitis, we know with the name itself, acute maybe something with very for short time of period. Okay, usually starts with cold like symptoms. In normal cold like symptoms it start, such as runny nose and facial pain, everything, or many other symptoms are there. It may start suddenly and last for 2 to 4 weeks. Okay, last for 2 to 4 weeks. The main thing in understanding these variations, we need to learn this for what it lasts. Okay, now subacute sinuses inflammation usually lasts for 4 to 12 weeks. You need to learn only these. Okay, these numbers. Okay, now chronic sinusitis, it will be 12 weeks and the longer. Okay, then recurrent sinusitis, matlab wo it happens again and again, happens several times a year. It happens again and again, no fixed time. It can happen anytime.
I'm
Okay,
a little slow, ma'am.
what?
A little slow.
You
You're too fast.
okay, I should repeat this. This is last slide. If any problem, I will repeat the whole also, or if one thing you can ask. I will repeat, okay? Acute sinusitis. The word acute itself says small or short, okay? Short period of time, small period of time, okay? Usually these symptoms started with like normal cold cough we used to have at home. Uh, in that we have different symptoms, runny nose, facial pains, eye pains, throat pain, everything like that. It starts with normal cold cough symptoms, and further it lasts for may last for 2 to 4 weeks. Okay, 2 to 4 weeks it will last, and then we have subacute sinusitis. That is, inflammation usually lasts for 4 to 12 weeks. Okay, 4 to 12 weeks. The main thing to learn is these timings. Okay, in acute 2 to 4 weeks, in subacute 4 to 12 weeks, in chronic sinusitis it will last for 12 weeks or longer. This is too long. Okay, and recurrent sinusitis, with the name itself we can understand it is reoccurring again and again. We don't know, in year it can again and again occur accordingly. So this is called as recurrent sinusitis. Happens several times a year. It can reoccur again and again. Okay, this is clear now, or any doubt?
No, ma'am.
Clear,
Clear.
ma'am.
So with this, will now time also happens. This is enough. Okay, otherwise it will be too much burden. We'll study one disease if it is long. If it will be little small, then we can go for two disease. Okay, we'll try to cover 2 diseases a day. Okay, so hopefully you all understand.
Yes, ma'am.
Understand? Okay. Any
Yes.
doubt you can ask. Everyone is there or sleeping, or only phone is on.
Yeah, we are there, ma'am.
Yes,
Aarti ma'am.
ma'am.
Okay,
Yes,
and this
ma'am. We are.
Rajdeep Pal sir
Yes, ma'am.
and Rupali Singh. Okay, okay. So all you all understand. So can we have a revision session today only, or tomorrow you will all study and I will ask a little questions?
Ma'am, I have one question.
Yes, yes, yes.
What is the I understand sinusitis, but what is the meaning of rhinitis?
Rhinitis. So I will
Itis, you say that itis I understand, inflammation or that like thing, but rhinitis I don't understand.
Rhinitis is like irritation or swelling in the mucous region. Swelling is the word for itis, but rhinitis is in the nostril region. I think irritation and all. If exactly you want the word meaning, I will tell you tomorrow. Okay, exactly the word I cannot
Okay, ma'am.
now. Okay, I'll tell you definitely. So now tell me whether now your question answers I should tell or tomorrow.
We have some time, right, ma'am? We can use it.
Okay, so we'll who will tell the exact difference between allergic rhinitis and sinusitis? Raise your hands. Raise your hands. Oh. Okay, Aarti ma'am, you tell.
Yes, ma'am.
Yes.
Rhinitis is the inflammation in the irritation in the nasal cavity, and sinusitis is the inflammation between the in between the sinuses that are in 4 pairs:
In
under
what
the
which?
eyes, behind the eyes, frontal part, and between the eyes.
Okay. So in which part, in which layer of these nostril and which layer of sinuses?
Uh, Around the sinus area.
What layer at make you?
Mucous membrane. Mucous
Yes,
membrane.
very good, very good. That was exactly what I want. Okay. So now, what are the allergens? Rupali Singh, can you make understand? Rupali Singh. Rupali Singh, are you there? Please reply. If you don't know, it's okay. Anita G.
Yes, ma'am.
Yes, ma'am. Can you tell?
Allergens like short-term, like climatic, due to climate, pollens, food like that. If we take means one type of food, it is classified like 4
Yes,
types
ma'am.
of
Very good.
allergies.
No. That I'm not asking. These are actually types of. You are telling correctly, not wrong. But these are types of allergens. Na? These are names or types of allergens. But exactly allergens are. Do you know? If no, it's okay. If you know, you can tell. Please fast.
No, ma'am, I want to understand some other, let them say, ma'am.
Okay, Usha ma'am will. You're not understanding, na? Usha ma'am will tell you.